So what are the risks of liposuction?
Risks of liposuction, and again, this is not meant to be a totally inclusive list, but most commonly, I think, irregularities or asymmetry. And those can be from very subtle irregularities, a line or a ridge, or say a little area where there's some fat that was missed. And that's probably the most common thing. Maybe when you're operating on two different legs, there can be some difference, one leg versus the other. Maybe a little bit more was removed. It's very difficult in surgery to assess about symmetry and whether an area is missed or not. Because we fill, as I described, we fill the area with a lot of fluid and makes it 2 or 3 times as large as it normally is. I mean, it's very distorted in the shape, and then what we do is start to remove some of the fat in the water that's been injected, and I pinch everywhere and make sure that it feels the same thickness everywhere before we stop. We measure carefully how much fluid went in, how much comes out, but there's swelling that is starting to occur while the surgery is going on. So at the end, the body part has gone through a lot of changes. It's gotten very big, then it's gotten small again. And at the end, we hope and assume that that is the shape that it's going to be at the end, but there's still some water that has to be reabsorbed from that area and the swelling to be reabsorbed before the healing is finished. So, you know, there's a lot of chances for a slight irregularity to occur. Fortunately, you can count on one hand the number of people that we've had to go back to surgery and maybe shave down one area a little bit more, or contour one area, one little spot a little bit more than the other side. It's very minimal in my practice, I think, because of the care and the precision that I try to take in measuring how much fluid comes out and how much goes in, and really take my time in doing that kind of analysis to be sure that it's just exactly right before we say that it's done.
Dr. Hendricks, what are some of the other risks with liposuction?
Some of the other risks besides the irregularities are bleeding, infection, which are all very rare. Risk of, very uncommon risks of some complication from anesthesia, nausea, vomiting. There's a risk of deep vein thrombosis or clotting that develops in one of the veins in the leg. By itself, that's not a huge risk, but that can develop into additional complicating problems if it's not addressed. There can be depressions when you're dealing with a laser or you're dealing with ultrasound. There's a risk of a burn that can lead to some death of the skin that may even need to be allowed to heal, or even may need a skin graft at some point down the road. Some people can develop a variation or some hyperpigmentation temporarily of the skin in the area that was treated. That's not very common. And always with liposuction, there's risk of injury to deeper structures. So that's, I think, in the overall scope of things, those are the major ones.